Bismillahirrahmanirrahim. Quote of the day: uh, so compete with one another in doing good. Al Quran. Assalamu alaikum everyone. My name is Dr. Marina Akhtar, PGR Community Medicine. Today my topic of presentation is Global and National Action Plan for NCDs, Non-Communicable Diseases, and Continuum of Pregnancy Care. I am presenting this topic under the kind supervision of my Professor Dr. Saira Afzal. Learning outlines. Introduction of the topic, Global Plan of Action, 9 voluntary targets of 2025, National Plan of Action, Continuum of Pregnancy, recent updates and MCQs. Learning outcomes. At the end of this presentation, participants will be able to describe the Global Plan of Action, National Plan of Action on NCDs, non-communicable diseases, Continuum of Pregnancy Care. They will be able to answer the MCQ session at the end. Introduction. The World Health Organization (WHO) has developed a strategy to reduce premature mortality from NCDs, non-communicable diseases, by 25% by year 2025 by setting target for improvement in obesity, diabetes, raised blood pressure, tobacco use, salt intake, physical inactivity, and harmful use of alcohol. Objective of Global Action Plan. First one is to raise the priority according to the prevention and control of non-communicable diseases in global, regional, and national agendas and internationally agreed development goals through strengthened international cooperation and advocacy. And other objective is to strengthen national capacity, leadership, governance, multi-sectorial action, partnerships to accelerate country response for prevention and control of non-communicable diseases. And other objective is to reduce modifiable risk factors for non-communicable diseases and underlying social determinants through creation of health promoting environment. And two, strengthen and orient health system to address the prevention and control of non-communicable diseases and the underlying social determinants through people-centered primary health care and universal health coverage. And to promote and support national capacity for high quality research and development for prevention and control of non-communicable diseases and to prevent and to monitor the trends and determinants of non-communicable diseases and evaluate progress in their prevention and control. Overarching principles. First one is human rights approach, equity-based approach, multi-sectorial action, life course approach, empowerment of people and communities, evidence-based strategies, and universal health coverage. We will explain all one by one. Human rights approach. It should be recognized that the enjoyment of the highest attainable standard of the health is one of the fundamental rights of every human being. Without distinction of race, color, sex, language, religion, political or other opinion, national or social origin, property, birth, and other status. Equity-based approach. It should be recognized that unequal burden of non-communicable disease is influenced by the social determinants of health. Action on these determinants, both for vulnerable groups and the entire population, is essential to reduce the overall burden of non-communicable diseases and create inclusive, equitable, economically productive, and healthy society. This picture showing difference between equality and equity. Multi-sectorial action. It should be recognized that effective non-communicable disease prevention and control require leadership, coordinated multi-stakeholder engagement, and multi-sectorial action for health, both at the government level and at the level of wide range of actors. Government approach across the sector such as health, agriculture, communication, education, employment, energy, environment, finance, food, foreign affairs, housing, justice, and security. Life course approach. Opportunities to prevent and control non-communicable diseases occur at multi-stage of life. Intervention in early life often offer the best chance for primary prevention, Policies, plans, services for the prevention and control of non-communicable diseases need to take account of health and social needs at all stages of life course, starting with maternal health, including preconception, antenatal and postnatal care, and maternal nutrition. Empowerment of people and communities. People and communities should be empowered and involved in activities for the prevention and control of non-communicable diseases, including advocacy plus a policy, planning, legislation, service provision. Evidence-based strategies. Strategies and practices for prevention and control of non-communicable diseases need to be based on scientific evidence. Universal health coverage. All people should have access without discrimination to nationally determined sets of needed promotive, preventive, curative, rehabilitative, and palliative basic health services, and provide medicines and diagnosis which are essential, safe, and curative. Voluntary Global Target 2025. Set of 9 voluntary global targets for achievement by 2025 for the prevention and the control of non-communicable diseases. The target related to 25% relative reduction in overall mortality from cardiovascular diseases, cancer, diabetes, and chronic respiratory diseases concerns premature mortality from non-communicable diseases between 30 to 70. A 25% relative reduction in overall mortality from cardiovascular disease, cancer, diabetes, or chronic respiratory disease. At least 10% relative reduction in the harmful use of alcohol as appropriate within the national context. A 10% relative reduction in the prevalence of insufficient physical activity. A 30% relative reduction in mean population intake of salt and or sodium. 30% relative reduction in the prevalence of current tobacco use in person ages 15 plus years. A 25% relative reduction in the prevalence of the raised blood pressure or contain the prevalence of raised blood pressure according to national circumstances. Halt the rise in the diabetes and obesity. At least 50% of eligible people receive drug therapy and counseling, including glycemic control to prevent heart attack and stroke, and 80% availability of affordable basic technologies and essential medicine, including generics, required to treat major non-communicable diseases in both public and private facilities. This picture showing the 9 sets of voluntary global non-communicable disease target for 2025. National policy for control of NCDs. The action plans has been modeled on the integrated approach to the prevention and control of NCDs and health promotion. It delivers an integrated framework of action IFA, which narrows down the broad agenda for prevention of NCDs. Public-private partnership. The multidisciplinary nature of the approach to the prevention and control of NCDs warrants changes at the level of the individual and the community, the health system, and the health policy maker. This diverse playing field is ideal setting to approach through a private-public international health agency partnership agreement. Integrated approach to NCDs. Disease domain integration. The term NCDs is technically reserved for the group of preventable disease that are linked to the common risk factor. Cardiovascular disease, some chronic lung conditions, cancer, and diabetes fall within this category. Action level integration. The paradigm of NCD prevention referred to above is multidisciplinary in nature. It calls for a diverse range of actions involving policy development, legislation, regulation, public and professional education, guideline development, and media interventions and research. System level integration. The approach adopted as a part of the action plan horizontally integrates the NCD prevention agenda and existing public health primary health care, and social welfare infrastructure. Integration of concepts. These include a behavioral research and social marketing, guided communication strategy, and active role for social opinion leaders and educational institution reorientation of the health services to a more preventive orientation. Evidence-based approach. This effort is an example of the incorporation of the core public health principles into country health uh, program plan through an approach that seeks evidence before planning intervention and utilizes intervention monitoring to generate further evidence. Maximizing the strengths of partnership. This initiative also created a mechanism for visible involvement and participation of the relevant ministries, educational institutions, NGOs, and leadership foci at the national consultation level and created avenues for for their participation. Linkage with national health policy. A careful review of Pakistan's current health policies show that this action plan is set within the existing policy framework. It focuses on prevention and the control of diseases that are both hazardous and largely preventable. Relationship with development agenda. Poverty eradication has assumed a center stage in position in the global development scenario. However, in addressing health issues within this framework, global attention remains focused on the health associated goal embodied in Sustainable Development Goals (SDGs). Unrealized ancillary benefits. The strategy outlined in this action plan has many ancillary benefits that have not been addressed directly. The action plan brings health benefits to all other age groups, assistance with healthier lifestyle that are essential to reproductive health, enables a reinforcement of the nutritional strategy and promotes prevention related practices which have implications for disabilities such as cataracts. Action plan specific description and clarification. Definitions of NCDs, activities orienting in different parts of the health sector need to be synchronized for concerted action aimed at reduction in disease related mortality and morbidity. Priority setting. Priority setting is imperative for a rational utilization of resources for public health program in a country. The combined approach matrix CAM is used to assist with setting priority. This approach is found to be a useful tool for organizing information. Common areas of action in IFA. The integrated framework of action encompasses two sets of strategies. The first strategy includes behavioral change communication, reorientation of the health services, and monitoring and surveillance. The second pertains to legislative and regulatory matters. Behavior communication. The aim of community interventions as a part of this action plan is to support the evolution of a set of the cultural practices that get embodied as lifestyle habits within the population of Pakistan. The IFA focuses on modifying individual, group, community behavior through media and other community intervention and target individual in appropriate settings. Reorientation of the health services, training of the health professional, infrastructure at the healthcare settings, and the drugs at basic healthcare level. Research. This action plan attempts to bridge the gap between academic researchers and policymakers and administrators engaged in planning evidence-based strategies for bringing about the improvement in the health outcomes. A necessary prerequisite for effective planning, implementation and evaluation of NCD prevention programs in access to reliable and timely information on mortality, morbidity, risk factors, and their socio-economic determinants. Common area of action, primordial prevention and health promotion. This particularly important in Pakistan's healthcare and cultural context where community health intervention should logically be structured to draw support from the extensive network of health providers at the grassroots level. Strong tripartite partnership between Ministry of Health, WHO, Heart File has been stepped up to lead this action. And our second topic is continuum of pregnancy care. Integration. An integrated approach implies that all those involved in maternity care, from obst- obstetricians down to local DI, must work as a team. Obstetric and pediatric units should be closely linked so that there can be regular contact between obstetrician, pediatrician, community physician, health and social workers, so that the service for the care of mother and the child in the hospital and the community must be planned and reviewed, including teaching and research. This approach helps to promote the continuity of care and improve the efficiency and effectiveness of MCH care. Interventions are delivered in packages, advantages of which are many interventions go naturally together because they are delivered by the same person at the same time. Packaging is more cost effective in terms of training, implementation, and supervision. Packaging meets the need for the caregiver and the child much better than isolated and uncoordinated single intervention delivery, reinforcing the continuum of care. Intervention of continuum care integrated at all levels. Level of care are referral and tertiary level facility. Pregnancy, special screening. In pregnancy, there should be special screening, track RH antibody level during pregnancy. At birth, skilled care, comprehensive emergency operation center, EOC, prevent congenital infection in newborn. And then on in newborn, emergency care and neonatal screening should be available. Primary and secondary level facility, antenatal care. There should be 4 antenatal visits, intermittent preventive treatment for malaria, IPTP, bed nets for malaria, and maternal chronic condition, availability of folic acid, iron, calcium, and avoiding hazardous states, monitoring of fetal well-being. Intranatal care, skilled care for delivery, early detection, and referral for illness during labor. Observe three cleans: clean hands, clean delivery service, and clean cord cutting. Avoiding three delays: deciding to seek care, reaching a health facility, and receiving quality care. Postnatal care, which include early neonatal care, that include at primary level basic care for healthy newborn, including essential immunization and monitoring for common issues like jaundice. And at secondary level, more specialized care for newborns with complications such as respiratory distress or low birth weight. This may involve the use of incubators, phototherapy for jaundice, and oxygen support. And the second is late neonatal care. At primary level, continued monitoring of growth, weight gain, general health, basic care of the common issues like feeding difficulty or infections. At secondary level, specialized care for infants with persistent health concern or those requiring surgical intervention. This may include advanced imaging, surgical facilities, and specialized medical staff. Community and family care level. Community based delivery of the contraceptives, menstrual hygiene, and gender violence, counseling, and the birth preparedness referral. Where skilled care is not available, consider the domiciliary care, that is three cleans: clean hands, clean service, clean cutting of the cord by trained birth attendants, and immediate newborn care. Now coming to the recent updates. Our first article is Barrier to Global Action Plan for Prevention and Control of Non-Communicable Diseases, Proposal Modification to Voluntary Targets. Abstract. Uh, WHO member states gathered to draft a global action plan for the prevention and control of the non-communicable disease. A global overreaching target 25%, 25% to 2025. The four major NCDs: cardiovascular disease, cancer, diabetes, or chronic respiratory disease by 2025 was adopted. The primary aim of this review is to identify the main barrier for reaching this plan using uh, pertinent available evidence. The secondary aim is to re-examine the data with dual purposes. for amplifying beneficial effects of the voluntary global targets and expanding the population to which they apply. There have five interrelated barriers. One is extremely low prevalence of ideal cardiovascular health. Second is gap in the affordability of essential medication. Third is gap in the health system. Fourth is low adherence to medication. Fifth is gap in voluntary global targets. Conclusion is modification in the voluntary global targets are being proposed to produce greater effectiveness and extend reach. To this end, more ambitious risk factor targets for larger proportion of the population and major efforts to strengthen healthcare system are urgently needed. And the second article is effective linkage of continuum of care for improving neonatal, perinatal, and maternal mortality, a systematic review and meta-analysis. The objective of this present study is to assess the effectiveness of the different continuum of the care linkage for reducing neonatal, perinatal, and maternal mortality in low and middle income countries. They search for randomized and cozy randomized controlled trials for that review. And the conclusion of this review is suggests that continuous uptake of antenatal care, skilled birth attendants, and postnatal care is necessary to improve MNCH outcomes in low and middle income countries. The review was conclusive for reduction of neonatal and perinatal deaths, although maternal deaths were not significantly reduced. Composite measures of all mortality were, thus the evidence is sufficient to scale up this intervention package for improvement of MNCH outcome. Now coming to our MCQ session. MCQ number 1 is, in the global action of prevention and for non-communicable diseases, it is recognized that many approaches work together because of the common risk factor. Which type of approach is explained in this statement? Option A is integrated approach, option B is equity based approach, option C is human right approach, option D is multi-sectorial approach, option E is evidence based approach.
A.
Yes, A is the right
A.
answer. And second MCQ is HLM3, third high level meeting of General Assembly political declaration on non-communicable diseases, transformed 4 into 4 into 5 into 5 agenda. Which risk factor is added in this agenda? Option A is unhealthy diet, option B alcohol, option C smoking, option D air pollution, option E noise pollution. Answer is D, air pollution was added in this agenda. MCQ number 3 is, in science and philosophy, a paradigm is a distinct set of concept or thought pattern including theories. The paradigm has been suggested for the control of NCDs. Which level of prevention constitute the major part of paradigm? Option A primordial prevention, option B primary prevention, option C secondary prevention, option D tertiary prevention, option E domiciliary care.
A.
Yes,
A.
yes, A is right answer. MCQ number 4 is the approach which implies all those involved in maternity care for obstetrician down to the local DI must work as a team. The obstetric and pediatric unit should be closely linked to so that there can be regular contact between obstetrician and pediatrician, community physician, health and social worker. Which approach is explained in this scenario? Option A is evidence-based approach, option B is multi-sectorial approach, option C is trans-sectorial approach, option D is integrated approach, and option is life course approach.
B.
B.
4 is D, integrated approach. Fifth MCQ is, a city is witnessing an increase in the number of the people with respiratory diseases related to air pollution. How can a city align with global plan for NCD to address this issue? Option is implementing policies to increase vehicular emissions. Option B establishing green spaces and promoting active transportation. Option C, encouraging industries to release more pollutant in the air. Option D, removing restrictions on the use of the coal for energy production. Option E, ignoring the monitoring of air quality standards.
B.
Yes, B is right answer.
C.
And sixth MCQ is, in the prevention of NCDs, many health professionals suggest a healthy lifestyle, and this is also beneficial for health reproductive system. Which type of benefit depicts in this statement? Option A, co-benefits. Option E, ancillary benefit. Option C, disability benefit. Option D, medical benefit. Option E, cost benefit.
B. D.
Yes, B is right answer.
B.
Yes. MCQ number 7 is, a woman is in active labor and the healthcare team is preparing for the delivery. What intervention is crucial to prevent potential complication during the intranatal stage? Option A, avoiding continuous fetal monitoring. Option B, conducting frequent cervical checks. Option E, administrating epidural anesthesia without proper monitoring. Option D, encouraging prolonged labor. Option E, planning for a timely C-section if needed.
B.
Yes,
A.
B
B.
is the right answer.
B.
E. 8 MCQ is, in global plan of action, it is decided that action on the determinants of the health both for vulnerable group and the entire population. It is essential to reduce the overall burden of the non-communicable disease. Which type of approach is this? Option A, right, human right approach. Option B, equity based approach. Option C, a life course approach. Or option D is evidence based approach. Option E is multi-sectorial approach.
E.
B is
E.
B is the right answer. Equity based approach. 9 MCQ is, a pregnant woman schedule her first prenatal appointment. What is the primary focus of the care during the initial stage of the continuum of pregnancy care? Option A, fetal ultrasound examination. Option B, monitoring fetal heart rate. Option C is assessing maternal nutrition and health status. Option D, administrating labor inducing medication. Option E is providing postpartum counseling.
C.
B.
C. C.
C is the right answer. 10. MCQ number 10 is, a country is experiencing a rising trend in the prevalence of the cardiovascular disease and diabetes. The government decides to implement a strategy to tackle this non-communicable disease. What would be a key component of the global plan to address this issue? Promoting smoking. Option A is promoting smoking in designated area. Option B, implementing a tax reduction on sugary snacks. Option C is enhancing public awareness about benefits of physical activity. Option D, allowing unrestricted marketing of high calorie fast food. Option E is distributing free samples of high blood pressure medication.
C.
Yes, C is the
Charlie.
right
C.
answer. C is the right answer. This is the key of MCQs, and thank you for your patience listen. And here is given the YouTube link of our channel where all YouTube or presentations are uploaded. Kindly like and subscribe. Thank you.
Okay, thank you very much, Dr. Marina. Very nice presentation. And the most important part is about the lifestyle choices and the lifestyle modifications, because that is the most important preventive aspect of all the non-communicable diseases. We know that non-communicable diseases are very increasing in as we are moving towards a trend of having fatty diets, less exercise, and our eating patterns and habits like long night stays. They are actually affecting our health in terms of obesity, hypertension, diabetes, and many other diseases. As the lifestyle modification, whenever we talk about the lifestyle modification, we know that there are very important components to it, and these components are we can divide into three primary components. Like first is the behavior, and for this we have to give the behavior therapy, we have to give the counseling, we have to make all the points clear. That is the basic part of our awareness campaigns, seminars, and community services that we are providing at school health services. and primary healthcare services like in basic health units and rural health centers. The second important component that is often missed is about nutrition. Diet and nutrition, they are so important in preventing all the non-communicable diseases. And the unhealthy food, especially those foods that are cooked in unhealthy oils, that are not balanced in terms of carbohydrates, proteins, fats, and other contents. As we know that minimum requirement of everyone is based on the daily recommended allowance of antioxidants, minerals, and vitamins. We also need a lot of water to drink. We have to stop smoking, and we have to stop any type of drugs like alcohol or any other thing. It is the most important part of the lifestyle that has to be adopted. We know that there are certain individual patterns as well as there are certain cultural norms. We have to target both the individual factors as well as to decrease the cultural norms like having fatty diets, halwa, puri, pie, and the things that are associated with our lifestyle attitudes. And these attitudes or habits, they are not only developed over time, but also they make the cultural norms more fashionable and desirable. So it is very difficult to change the lifestyle without having the complete behavioral changes in the individual as well as in the groups, and to encompass the important awareness campaigns that are for the habits, behaviors, and choices. So these are few points that are from my side, and we know that there is a very important model for behavior that is called ABC model: A for affective domain, B for behavioral domain, and C for cognitive domain. And these models, they help to increase the awareness and to do the lifestyle modifications and to change the functioning of the whole society. Because when there is increased burden of the non-communicable diseases, there are increased demand of having the hospitals that are totally specialized hospitals like diabetic centers, institute of cardiologies, the institute of neurosciences, where the patients of different strokes, cardiovascular accidents can be dealt with. Similarly, even in we have in Punjab, we have different institute of cardiology, and they all are overburdened, and not a single institute is able to cater the needs of their population. Until and unless we go for the lifestyle modifications and the 5 levels of prevention, we can't deal with such a high load of the disease that is the non-communicable diseases. So the therapeutic lifestyle changes is the most important part where more research is being done, and the effective therapies like ABC therapy for behavior, they are improving the life as well as decreasing the risk factors associated with obesity, overweight, and also with diabetes, hypertension, and cardiovascular accidents, strokes, etc. Thank you very much. So we will have further discussion in our face-to-face class. Allah Hafiz, everyone.
Thank you so much, ma'am. Allah Hafiz, ma'am.
Allah Hafiz.